What is the FRAX score for geriatric osteoporosis? Imagine having a simple way to understand your risk of breaking a bone in the next decade. That's what the FRAX score does. It is a tool used to estimate the chance of experiencing a major osteoporotic fracture or a hip fracture within 10 years. For older adults, especially those aged 60 and above, this score is very helpful because the risk of osteoporosis and fractures naturally increases with age. As bones become weaker and more fragile, knowing your risk helps you and your healthcare provider make better decisions about prevention and treatment. The FRAX score considers many personal factors. These include your age, sex, weight, and height. It also looks at whether you have had previous fractures, if there is a family history of hip fractures, and whether you smoke or drink alcohol heavily. Certain medications that weaken bones, like long-term steroid use, are also part of the calculation. Additionally, health conditions such as rheumatoid arthritis or other illnesses that affect bones are included. Sometimes, a bone mineral density test at the hip is used to refine the score, but it is not always necessary. The result is a percentage that shows your likelihood of having a fracture in the next 10 years. In older adults, the FRAX score is especially important because the risk of fractures rises sharply with age. A higher score indicates a greater chance of breaking a bone. Generally, if your 10-year risk of a major osteoporotic fracture reaches 20% or more, or your risk of a hip fracture is 3% or higher, it is considered high. This may lead your healthcare provider to suggest further testing or starting preventive treatments. Different countries may have slightly different thresholds, but the goal remains the same: to identify those who need extra care to prevent fractures. It is important to remember that the FRAX score is not a diagnosis of osteoporosis. Instead, it is a screening tool that helps decide who should have more detailed testing, like a bone density scan, and who might benefit from lifestyle changes or medications. The score is most useful when combined with a full clinical assessment and bone density results if available. For older adults, understanding this risk helps in planning steps to keep bones strong and prevent painful fractures that can affect independence and quality of life. In summary, the FRAX score provides a personalized estimate of fracture risk over 10 years based on age and other health factors. A score above 20% for major fractures or above 3% for hip fractures generally indicates high risk in older adults. This information guides healthcare providers in recommending further tests or treatments to help maintain bone health and prevent fractures. Always consult your healthcare professional for an assessment tailored to your specific health situation.